Good evening. Welcome to the Fabulous Kings Fund. Am I shot? Okay, that's fine. Welcome to the Fabulous Kings Fund, where tonight we will be exploring the inner depths of public health. But first, a word from our sponsor. Ladies and gentlemen, Dr. Michael Thing. I took him by surprise.
This is the first time he's remembered for the last 5, I think.
Okay, right. Well, thank you very much, Michael. We're running out of time.
Well, as you can see, people often say, why do we put up with this ritual abuse? And we don't really do sponsorship. What we really want to do is to give everybody examples of what really good practice is, and the practice can vary in all sorts of ways. So tonight is public health. We've had Lord Carter talking about improvement. We've had Matthew Swindells talking about how do you make the NHS digital. And tonight we're lucky enough to have Shirley Cramer with us, and it's for this reason that we put up with him. Thank you.
There's nothing like a good introduction, and that was nothing like a good introduction. Anyway, listen, it's my great privilege and pleasure to welcome Dame, soon to be announced, Shirley Cramer, who is the Chief Executive of Her Majesty's Royal Academy of Public Health. Is that right?
Not quite.
Is it close enough?
Royal Society for Public Health. Not quite.
Which started off as the Sanitary Club, didn't it?
It's got a great history.
I know. I was reading about how I thought, how the hell did you end up being royal? Anything really? Because you're a lobby group, but you pinched it, didn't you?
I don't think that's true, Roy. We deserved it.
So tell us. So you nicked your title from the Sanitary Club.
I think it was the Institute of Hygiene.
No, but there was a merger. It was the sanitary. I remember the word sanitary and the hygiene thing, and you put them together, and it became. You got a Royal Charter in 1863. I think.
So we're 161 years old.
Yeah.
So actually, the oldest public health organisation in the world, just beating one of the American Public Health Association.
Yeah.
But it's had loads of different names. Over the years.
Well, it's mainly because public health has largely failed, isn't it, really? It's not achieved very much. I mean, we're all too fat, our diets are all terrible.
Speak for yourself,
Most
Roy.
people, as you said, just sit up straight and breathe in. I mean, well, we'll get onto that in a minute. Listen, where did it all start for you? Because you're from up north, aren't you, really?
I'm from Cumbria.
I know you've tried to become
Cumbrian.
southern and posh. No, you're in Gerrard's Cross, but we know really that you're...
No, I'm from West Cumbria,
Yeah.
the very, very unposh part of the Lake District, the strip down by the coast that was mining steel.
Yeah, a legacy
Industrial.
of public health problems. Yeah,
A legacy,
yeah. And then you went to uni?
Yep, I went, actually before that I spent a year in the States when I was 17 as a foreign student, which was...
Now, how did that happen? Because I was interested, because we'll come on to that in a minute, because you got your master's.
Yeah.
Was it an MBA or a master's?
Master of Science.
Yeah.
In Columbia University.
In Columbia University, where you've got some very posh alumni there. Warren Buffet was...
Indeed.
Yes. A Warren all-you-can-eat for £1, yes. Yeah, you didn't meet... No, he was there in 57, it was much too early. Yeah, much too early for you.
It's slightly
Yes,
early,
yeah.
thank you, Roy.
Yeah.
But
yeah,
a bit early, but...
How did a 17-year-old lass from downtown Cumbria end up in America?
So there was a program which is still running in the States called the American Field Service Scholarship Program, and actually was set up by ambulance drivers during the First World War who didn't want to fight but didn't want to be conscientious objectors, and believed that actually you could stop war by people understanding each other from different nations. So they set up this program called American Field Service, where Americans came to Europe and beyond, and those of us in Europe went and lived with a family for a year in the States.
And who was that through your school?
It was through the school. I saw it advertised and applied for it.
Yeah.
Thought it would be interesting, and it was. I lived with a very big
There was a
family.
lot of that going on. When I was a kid, I went to on a thing called Reconstruction, Youth and Reconstruction. And I worked in a summer camp with German, French and Italian kids of my own age. And of course at that time, just after the war, it was thought, well, you know, that was kind of an edgy thing to do.
Yeah.
My dad was a window cleaner. He was very keen for me to do it. He somehow or other arranged for me to, we had to go and buy all the kit for me to travel and all that stuff. I mean, it would have been for you to go to the States, it would have been a big adventure.
From West Cumbria, it was certainly a big adventure because we had to go to Oxford for 2 days to be told what it was like to live in America, and then we got on a chartered plane. It had stopped in Paris, so there were all the French, and then the Brits got on, and then off we went to New York, where they then put us in a college for another 2 days where we met all the South Americans and the others and learnt about what it would be like to live in America and how we needed to behave and what would be expected of us.
It's really
It's great
exciting.
experience.
Isn't it? So you eat hamburgers and watch movies.
Well, we got on a bus. I then got on a bus, and because that was the cheapest way to get us around. And it's a long way by bus from New York to Chicago. And then when you get there, off the bus, there's your family waiting to greet you, and you're going to live with them for a year. So it was quite, you know, I was quite young and inexperienced. This was quite a...
So you were 17.
thing.
You'd done your
I'd done my lower sixth.
yeah.
So I was
Was it
literally
GCSEs
missing my...
then, or was it
no,
matriculation?
It was year 12. So I'd finished year 12 when
Yeah.
I was my last year at school. So I spent it in the States.
So that was a real treat, wasn't it, to be able to do that?
It was a growing up for me.
Did you
because
enjoy it?
I loved it, actually. I was homesick for 3 months. And then once I got into the swing of things, one of the things I was expected to do was to go and talk to various societies about what it was like to live in England and what the English system was. And so that was quite an interesting thing to have to do, to be able to compare. And of course, it was quite a long time ago, and the high school kids in Chicago hadn't met anybody from England, and so they wanted to know, you know, did we have cars? Did we? And my first day of high school was very memorable because I'd been to a grammar school, and we had a very strict school uniform, including a hat and the whole thing. And I knew you could sort of wear what you want, but I wasn't that comfortable in just, and it was hot, you know, in any old clothes. So I wore my navy blue skirt and a white blouse, and I felt slightly out of it, and I was worried about speaking. And so we're all waiting for the teacher to come in, and they're in halter neck tops and shorts, and the teacher came in, and I stood up. Nobody else stood up. This wasn't the way they did it, so I immediately drew attention to myself, and that's how it started, the cultural difference.
Did they start the day singing the American national anthem?
No, we looked in a corner where it was played and did this, and had to learn that.
And what was the standard of living? Was it higher or different? Or
It was different. It was just very different. So, I mean, I was with a very middle-class family, Catholic family. They had 6 children. I was the oldest of 3 from lower middle-class family, I guess. And they were suburban America, which was a nice place to be in those days. Yeah. Huge high school, 15 in those days compared to my grammar school.
And you went to school?
Just 1 year.
Yeah. And what did you learn? Did you?
Well,
was the education system here ahead of or behind?
We were, certainly in those days. I'm not sure, certainly by the time you get to master's level, they're way ahead, I think, honestly. But at school level, definitely not, because you don't specialise as early. So when I produced my first bit of homework, I did it in the same way I'd have done it at the grammar school, so sort of 6 or 7 pages on some book we were supposed to write. And I got called in to the English teacher, and he said, can I just show you something? Can I show you what other people have written? Yes. A paragraph, 2 paragraphs at the most. He said, I actually couldn't have written this. Don't worry about it, you'll be fine. And so then I realised, okay, there were some things I wasn't going to be so good at, but actually I could concentrate on the things that were new to me and learn about that, and not worry so much about writing,
so
7-page essays.
So you stayed there for a year, you came back?
Came back and I did my A-levels and then went to university.
Yeah. And what did you study at university?
I studied applied social studies. So in those days, that was the BA CQSW. So when you came out of the 4-year course, you were a qualified social worker. And then I went, in those days, again, they were desperate, just as they are now, I think, for social workers. So local authorities were lining up to offer you the qualified people a job.
And what was you? I mean, you wouldn't have had an unsupervised caseload, but was it busy then? Where were you?
Do you know, I was in Southall area office, so my friends and I came down. We wanted to be in London, came to London, and when I think I was 22 probably, I had a huge caseload. I was emergency duty team. Because I had some mental health experience, one of my placements had been with eating disorders, that I was the mental health specialist in the emergency duty team at 22. And it was possibly the most stressful thing I've ever done. I have huge time for social workers. I think they get immense, they need sort of admiration and respect for the things that they deal with. But I had a caseload taking children into care. I spent half my time at court. I did adoption, but the mental health is the one I remember the most because, you know, I was responsible for signing people, in sectioning people.
You were responsible?
I was. Mm-hmm.
It's not like that now, is it? It's much
so,
more.
well, it needed to have a doctor and a social worker, a third person. Yeah. So, you know, I was at 22 in ambulances sectioning people.
So you did that for a while.
Yeah.
And then I'm interested to know how you got back to the States, because you've been...
So, well, listen, interesting. I got married and I was a trailing spouse.
Well, your husband's name is Carl.
He is.
And there is a famous American footballer called Carl Cramer. Did you know that?
I didn't actually know
and
that.
when I was researching, I thought, I wonder if you're married to the famous American footballer.
Interesting.
Yeah, you married the wrong Carl.
Obviously.
Because your Carl has just fallen off his bike.
He has, yes. Just to say, we've had an
NHS
NHS
and if you're watching,
experience.
Carl, we're really sorry.
Yes,
and Shirley's a rotten nurse.
Yeah, not so good.
Yeah.
A lot of respect for carers as well.
Yeah.
No, he was offered a job in New York, and we just thought, why not?
What does he do?
He's in finance. It was corporate finance, and it just seemed like a great opportunity to go and live in the States, to go and live in New York City.
Yeah.
And partly because I'd lived there before, I was thought it would be exciting.
Did you have connections there still?
We have loads now, but at the time when we first moved, we knew nobody in New York, and so that was a very interesting time in our lives, and I didn't have a work permit, so I didn't know I didn't have a work permit. He had one, and I didn't realise that I couldn't get a job in social services. That's how naive we were. And so I worked off the books for a few months in a store and applied to Columbia University in that time because I wanted to do my master's. And it was a great opportunity.
Did you have to pay for your master's?
We did.
Because it's a private university. It's unusual. It's a private
Columbia
university.
It's a big, private, wealthy university. I think I got a small scholarship, but they allowed me to do the 2-year master's in 13 months because of my applied social studies course. There were certainly things that I'd already done, so they allowed me to do it in 13 months. But it was 7 days a week for 13 months. I've never worked so hard in my life.
What did you write about? Did you do a thesis? What was it?
I did. I wrote... you won't have heard of Bertha Reynolds, but Bertha Reynolds was a social reformer. A social reformer, and she worked in the mills in Massachusetts. So I wrote a lot about her. I was interested in social policy, and I was so fortunate because it was right at the end of the careers of some very really important people who'd been involved in the Johnson White House. So they were in their mid-70s, but they're the ones. I mean, if you look at social policy in the USA now, these are the people that put in Chapter 1, all of the things that are the federal preventive programs go back to the Johnson era. And these were mainly amazing men, some of whom had come from Europe. There's one guy, Al, who had been in concentration camps. These were Jewish intellectuals, really, who'd written these policy papers. And so I was, this would be the last year they were teaching. So I've just felt, humbled to have sort of been at the end of their career and listening to their talks about it. And I was always very interested in at the sort of policy level in the States, because so much is done at local level or at, regional level. And the federal piece, which is where you say, how do we make something happen nationally? The things that we consider national standards are quite difficult And so you often get the discussion around an unfunded mandate. That means that there's some policy, but the federal government have put no money behind it.
Well, most of our policy here is like that, isn't it?
We could say
Why don't we
that.
just call it unfunded mandate?
An unfunded mandate,
Yeah. So you got kicked out of America. Life brought you back here.
Well, I went back again. So left in '86 for jobs back in the UK, and then
Did you come back as a social worker?
I came. Actually, I really wanted to work for New York City, so I wanted to go back into the public sector, and I wanted to be a social worker in the but I couldn't because I wasn't American.
Just pause you there. I mean, the kind of social work that you would do there, one imagines there's a huge kind of schizophrenic community, isn't there? You've got very wealthy, high-end New Yorkers, and then you've got not much of a middle class and a lot of poverty, and not much in the way of support, really.
No, it a very complicated system, but really what I was interested to be able to compare it and to understand it, but because I wasn't American, in those days you couldn't work for the public sector. So that's when I started my career in the voluntary sector, because I got immediately picked up to work in a large settlement house on the east side, and I worked there in program planning and fundraising and just sort of the architecture of what it is to run a voluntary sector organisation.
Well, it laid the foundation, really, for what has become your career.
Yeah,